This comment says, okay, so we should try to find the root of the problem instead of trying to redirect. Because that makes sense, we should fix the problem instead of giving a band-aid. And this commenter and I already chatted in the comments, but I really just wanted to highlight this because I think it's a really great question. And so my answer was, we absolutely should redirect if the dog is about to have a problem. We have management and we have damage control. Management is proactive, we're avoiding, that might include distracting, when the dog is about to be in a situation that they can't handle yet. Because we don't want negative associations to strengthen, we don't want unwanted behaviors to be rehearsed, we don't want people to be unsafe, and we don't want stress to trigger stack. So our management helps make our behavior modification more efficient and is just good for the well-being of the dog. Redirecting is probably a little bit more reactive. So the dog is already having a hard time. We've got some negative emotions happening. Stress levels are going up, and we're trying to do some damage control. We're trying to minimize that. And so if my dog is reacting at the fence or at the window, they're barking, they're jumping, I'm going to help them move away and engage in something that lowers their stress levels, like a scatter feed or a licking activity, versus staying close to the trigger in that fight response. And so I might redirect them in that way, absolutely. But if I'm having to redirect, things have gone awry. I'm having a management oops. So that is not how I would create a training setup. In a training setup, we are in a green zone brain, and that is important for efficient behavior therapy because when my dog's stress hormones are at a good level and their parasympathetic nervous system is primarily engaged and they can think, they can learn, they can remember, they can process information, they can access problem-solving skills and curiosity and pro-social behavior. And when stress hormones increase, that becomes inefficient at best, impossible at worst. And so in that behavior modification, I'm ironically not just looking or even really looking at the behavior. The behavior is a symptom. The behavior tells me something about the dog's emotions, and it tells me something about their arousal levels. And that information allows me to adjust my training setup and perhaps adjust my management. But the actual behavior modification is hopefully happening in the green zone. And so there's nothing to redirect from. And so what we're doing there is classical conditioning. We're changing emotion. We're increasing agency. We are building social skills. It depends a little bit on what we're working on and what the trigger is. But it's both an art and a science. And so it can be tricky if we get just a little bit wrong, or as I've seen in some of the comments from some other pet professionals, there isn't a clear understanding on exactly what is being done. And so the protocols kind of get confused and mixed up amongst each other. And that's where things go wrong. And that's what my original video was about, is that we have some pet professionals who are using positive reinforcement, which is like, a buzzword, a green flag, but they're using it to treat behavior. And so while they're not doing harm in the sense of like punishing and suppressing behavior, they're not increasing anxiety and aggression in that way. They're also putting the clients in a position to sort of spin their wheels. And a dog who needs safety is getting taught to sit and stay. And a dog who needs to learn how to self-regulate is being put on their place. And that's not what the dog needs. And so it can be really harmful.